Hey everyone, welcome back to my channel. So a lot of you guys asked me about a video for the Dexamethasone Suppression Test, and I'm gonna give you a very nice scheme in this simple video. So let's get started. Alright, so before we dive into the actual test, I want to remind you guys of the hypothalamic pituitary axis and the negative feedback. So the anterior pituitary releases ACTH, and this is what drives release of cortisol from the adrenal cortex. In turn, this cortisol will exert negative feedback on the pituitary to stop further ACTH production and therefore stop cortisol production. So this is key to understand what's coming. That cortisol exerts negative feedback on itself, which means it has receptors on the anterior pituitary. Now imagine you got a patient looking like this and you suspect Cushing syndrome. You want to confirm that this patient truly has increased cortisol. So you're going to do a dexamethasone suppression test. That's to confirm that this person has increased cortisol. So the first thing we do is a screening test. This is the screening test. You give the patient low dose of dexamethasone, which is a type of cortisol. We are expecting it to act just like cortisol by negative feedback on the anterior pituitary, causing less production of ACTH and therefore less cortisol. So a normal response will be suppression of cortisol, which will result in a low level of plasma cortisol after this test. But in a patient with Cushing syndrome, regardless of the cause, a patient who has a lot of cortisol in their blood will not be suppressed enough because there is already very high levels of cortisol in this person's blood, and it will show no suppression. Okay, as simple as that. Anyone with high cortisol level, regardless of the cause, will have an abnormal low dose dexamethasone suppression test. Now, we still did not get an actual answer. Like, now we confirmed that this patient has high cortisol, or that our suspicion is correct. This person has Cushing syndrome. This was just for screening, but we need to know why. Like, why does this patient have a lot of cortisol in his blood? Is it because we have increased cortisol because you are taking drugs from outside, or because there is an adrenal cortical tumor secreting a lot of cortisol? Irrespective of the level of ACTH, hence ACTH independent, it means that cortisol is being secreted whether from the tumor or you're taking it from outside. You got a lot of cortisol not because you have a lot of ACTH, or you have a lot of cortisol because you have a lot of ACTH. That's called ACTH dependent Cushing syndrome. And so it's this ACTH that's producing extra cortisol by acting on the adrenal cortex. And this could be because of a pituitary adenoma or because of ectopic production of ACTH from lung cancer. So in order to differentiate those causes, ACTH dependent or independent, we're going to do an ACTH level. Now, you guys know, remember the negative feedback. If we have a lot of cortisol that's produced independent of the level of ACTH, it's going to exert negative feedback and stop further ACTH production. And that's why in ACTH independent Cushing, we have undetectable ACTH levels because of the negative feedback. unlike with the ACTH dependent, where the cause of increased cortisol to begin with is a lot of ACTH, so we're going to find it's high. This way we narrowed down our diagnosis. We did the screening test and now the ACTH test. Finally, I still need to differentiate the actual cause in the ACTH dependent types, so I'm going to do a high dose dexamethasone test. Now, we know, guys, that cortisol has receptors on the pituitary gland, and so high dose of dexamethasone, when you give a very high dose, it will at least bind some of the receptors on the pituitary and stop some of cortisol production if the cause was really a pituitary adenoma. So even though we have a lot of adenoma cells, yet we have receptors that can respond to high dose of dexamethasone and are able to suppress cortisol production greater than 50% reduction. That's suppression. Versus, for example, lung cancer, the tumor cells obviously do not have receptors for dexamethasone, so it's not going to suppress any further ACTH production. It's ectopic production, so there's going to be no suppression. So this is a summary. If you suspect Cushing syndrome, you confirm with the low dose test. In all cases, it's going to come out abnormal. I still need to know why. Measure ACTH, independent or dependent, and differentiate by the high dose dexamethasone. I hope this video helped. Let me know what you think in the comments.